What really causes gallstones? Why do some people suddenly feel severe pain under the ribs? Can gallstones become dangerous? Which foods make the condition worse? And what should you eat instead? In this video, you will find clear answers to the most searched questions about gallstones, their symptoms, causes, treatment, diet, and prevention. Stay until the end, because understanding these warning signs early could help prevent serious complications. Gallstone disease happens when stones form inside the gallbladder, the bile ducts, or sometimes even inside the liver and hepatic ducts. The gallbladder is a small organ located next to the liver, and its job is to store bile, a digestive fluid produced by the liver. These stones can have different sizes and shapes, and they often irritate the walls of the gallbladder, which can lead to inflammation known as cholecystitis. Most gallstones are made from cholesterol crystals. In rarer cases, they are formed from calcium salts and pigments. Severe gallbladder pain, also called biliary colic, usually happens when a stone blocks the duct that carries bile from the gallbladder to the small intestine. Gallstone disease is especially common in industrialized countries, where people consume large amounts of animal fats and protein-rich foods. According to statistics, women are diagnosed with gallstones 5 to 8 times more often than men. The most common symptoms of gallstones include sudden stabbing or piercing pain in the liver area and under the right ribs. Some people also experience nausea and vomiting. Because bile can flow back into the stomach, a bitter taste may appear in the mouth along with belching. Many patients suffer from gas, constipation, or diarrhea, and even changes in stool color. Weakness, tiredness, fever, and jaundice may also occur. Gallbladder attacks often begin after eating fatty, fried, spicy, or heavy foods, drinking alcohol, or during periods of stress and physical strain. The pain usually starts on the right side under the ribs and can spread to the shoulder, arm, shoulder blade, lower back, or even the right side of the neck. Sometimes the pain can even feel similar to a heart attack and spread behind the breastbone. This pain develops because the muscles of the gallbladder and bile ducts go into spasm. The stones irritate the gallbladder walls or stretch them because too much bile builds up inside. Extremely severe pain can also happen when stones block the bile ducts completely. When the ducts become blocked, the liver may enlarge, causing a constant dull pain and a feeling of heaviness in the upper right abdomen. In these cases, obstructive jaundice can develop, making the skin and the whites of the eyes turn yellow. Complete blockage may also cause fever, chills, heavy sweating, and even seizures. Normally, healthy bile is liquid and does not form stones. Gallstones appear when the balance of bile changes. Several factors increase the risk. One major factor is high cholesterol levels in bile. Another is poor bile flow and bile stagnation. Infections spreading into the gallbladder can also lead to inflammation and stone formation. The main reason gallstones develop is an imbalance between cholesterol and bile acids. When bile contains too much cholesterol and not enough bile acids, it becomes more likely to form stones. Several things can increase cholesterol levels in bile. Eating too many foods rich in animal fats is one cause. Liver dysfunction that reduces bile acid production is another. Obesity is also very common among gallstone patients and is found in nearly 2/3 of cases. Long-term use of oral contraceptives containing estrogen can increase risk in women. Other medical conditions linked to gallstones include diabetes, hemolytic anemia, liver cirrhosis, allergies, Crohn's disease, and other autoimmune disorders. There are two main types of stone formation. Primary stones form in unchanged bile ducts and may not cause symptoms for a very long time. Secondary stones appear because of bile flow disorders, reduced bile entering the intestine, increased pressure in the bile ducts, or blockage caused by primary stones. These blockages can also allow infections from the intestines to travel upward into the gallbladder. Diet plays a very important role in gallstone disease. Doctors usually recommend eating small meals 5 or 6 times a day. Regular eating helps stimulate bile flow and prevents bile stagnation. However, eating a very large meal can force the gallbladder to contract suddenly and worsen symptoms. The diet should contain enough animal protein, but heavy animal fats are often poorly tolerated, so vegetable oils are usually preferred. Foods rich in magnesium may also be helpful. Recommended foods include lean meat and fish, cheese, cottage cheese, and low-fat milk products. Healthy grains such as buckwheat and oatmeal are also beneficial. Fruits and vegetables like pumpkin, carrots, zucchini, cauliflower, apples, watermelon, and prunes are commonly recommended. Fruit juices, mineral water, blueberry juice, pomegranate juice, and quince juice may also help. Certain foods should be avoided. These include fatty meats like pork, lamb, and fatty beef, as well as fatty fish, lard, liver, and organ meats. Sausages, smoked meats, canned foods, and pickled products are also not recommended. Butter should only be used in very small amounts. Beans, radishes, horseradish, eggplant, cucumbers, artichokes, asparagus, onions, and garlic can irritate the digestive system. Fried, sour, and spicy foods should also be limited, along with rich broths, coffee, cocoa, and alcohol. Preventing gallstones is possible in many cases. Large meals high in fat and cholesterol should be avoided. If a person is overweight or obese, gradual weight loss combined with exercise is recommended. Supporting healthy metabolism is also important because it helps reduce cholesterol production in the liver and encourages bile acid secretion. In some cases, medications such as Zixarin and Liobil may be prescribed for this purpose. Gallstones may start silently, but ignoring the symptoms can lead to serious complications. Understanding the causes, recognizing the warning signs early, and following the right diet and lifestyle can make a huge difference. If you found this video helpful, make sure to watch until the end, share it with others, and stay informed about your health.